I took my mammogram and I was surprised. I had to come back to be retested. They saw something and it was cancer. And I said, my God. And I said,
I went for just an annual checkup and my primary care doctor diagnosed me or found a lump in my breast.
I cried for one day, but then I stopped crying. I really did, because it didn't do any good to cry.
I was 35 at the time, so it came as quite a shock.
I get emotional about this because I've always been happy, and I refuse to just worry about breast cancer.
When they say that it's 90% curable, that means 10 years out. And 10 years from my diagnosis was 45, and I knew my kids were only going to be 15 and 17, and that just wasn't enough.
I have bills like everybody else, but through the foundation, they helped me out a lot. I didn't have to worry at all, but they just don't know how they just took a lot of burden off me, worrying about taking care of my family and then taking care of me and stuff.
They were very generous with a donation to me that helped pay my household bills for a few months. The easing of my anxiety, I can't put it into words even, how much this particular foundation has done for my life and the lives of my children and the lives of my patients. It's like a full circle, and anything I can do for these people, I'm willing.
What I would like is to have a staff that is completely committed to quality and excellence. Nurses are always looking for an opportunity to go back to school to learn more about their profession, how they can do their jobs better. If you have the aptitude for it and the drive, the funding should not be a problem with education, and the foundation is there to help. Many of the nurses that came to me for scholarship funding were fairly new to me, at least by their practice. So I had to do a little research and talking to their managers, talking to their coworkers to ensure that this is something that we want to invest in this person. Some of the things I looked for were those informal leaders on the unit. We have our managers, we have our assistant nurse managers, but they have go-tos on the unit that they always turn to when things need to get done. I wanted to invest in those folks to ensure that they stick around to help us as we move forward. We gained from this. One of our things is working on quality, ensuring our patient care and quality are at the highest levels possible. The end result of this is that I get a nurse who is able to pursue his or her dreams. The nurses get that skill set of looking at what's best practices and bringing those practices to the bedside. Without the foundation, I think that we would have a lot of challenges in keeping those staff who are pursuing higher education. Those nurses who want to do it will find a way, and we're lucky to have this opportunity that we can offer them to keep them here within the organization.
I got off from work that morning like I would any morning, went home and went to bed. Suddenly my door was flung open to my bedroom, and it was my significant other's mom. She hollered fire. I jumped up and ran in my kitchen, and the stove and the cabinets above the stove was on fire, and there was fire already creeping across the ceiling of the kitchen. The fire department came and put it out, and then about 3 hours later we got another call that it had reignited, and that finished it off. And so I lost everything I had except for a pair of scrub pants and a t-shirt, including my car. It was a little bit later in the evening, Judy Morris called me on my phone to reassure me and to check on me and let me know that University Hospital Foundation was going to be reaching out to me, and if I would stop by the next morning, they would have something for me to help me out. When you're suddenly faced with a loss of everything, including things that we take for granted every day, like a toothbrush, when you suddenly don't have that and you don't know what to do because you've never been through it before, when someone steps up like University Hospital Foundation did and just gives you a check so that you can go out and buy those necessities, immediately, it just means so much.
People are good, and we can all help, and it doesn't have to be a large check. Every little bit counts, and you never know when it might be you.
It is an investment. The staff that we want the best. University wants to be the best, and they can be the best by investing in their people, and University Foundation does that.
If everybody contributes just a little, then the University Hospital Foundation can help in ways that matter immensely.
It was a very dark time, and I was very sick, and to think of my outcome as positive as it's been in my remission and recovery, I give just as much credit to the foundation as I do my physicians.
Thank you for taking the time to listen to a few stories about people we've been able to help because of those who support University Healthcare Foundation and University Hospital. And I'm here to ask you to do the same. It is the mission of University Healthcare System to improve the health of those we serve, and we need your help to do that. Join those in our community who care and support University Hospital, our patients, and University Healthcare Foundation. Our website is universityhealthcarefoundation.org, or you can send your gift to 2100 Central Avenue, Suite D1, Augusta, Georgia 30904. Thank you for supporting University Hospital.